the first question is, you know, why are we even having this conference? Why do we need to? I mean, there's so much information. We have the internet, there's tons of doctors. And I guess the question I'd like to ask is, what is the state of America's health? I mean, is things just the same as in 1970? Has anything changed? Are we doing just as well? I mean, 2021, where do we stand? Because a lot of people are excited about the stock market's up, technology's great, Apple's got lots of new phones, and a lot of people are excited about the new breakthroughs. So where in actual reality of health, what is the state of America's health, and how does it compare to the past? Let's get that as a baseline.
Yeah, we want to state the obvious. You want to set the stage? Go ahead.
No, go ahead. You go first.
Well, I wish I could say back in 1970 when I was a third-year med student on the first Earth Day. I remember I was a third-year med student at the University of Illinois in Chicago. And I was aware of the patients I was seeing in outpatient clinic. Many of them were a bit on the heavy side, saw lots of high blood pressure, diabetes, clogged arteries. Well, fast forward almost 50 years now of medical practice, and I wish I could say that Americans really picked up the ball and improved their health on an individual and national level. But alas, so we seem to have gone in the opposite direction. We got seduced by a life of comfort and processed foods filled with fat and salt and sugar that we sit on the couch and shovel in by the handful. And as a result, here we are in 2021, and we are more overweight and obese than ever. High blood pressure is rampant. Type 2 diabetes is, we're seeing it now in children. And every 30 seconds, someone grabs their chest and falls over with a heart attack. Every other one of them dies. And cancer of breast, uterus, prostate are really fearsome, as is still smoking and lung cancer. So our entire health picture as a nation certainly has not gotten better. We're barreling towards a real unsustainable situation, both medically, biologically, financially, and ethically, really. But in that bleak landscape, there are some flickers of hope, and there's no question that plant-based nutrition is firmly woven into the fabric at this point of awareness of what people need to do. More and more people are adopting more and more plant-based foods into their diet, whether they call themselves vegetarian or vegan or not. And the medical specialties begrudgingly are starting to recognize there's something to this nutrition stuff, something to this plant-based stuff. And the cardiology journals will have a plant-based article burble up, and the oncologists and pediatrics and allergies and dermatology and gastroenterology is starting to show in all the specialties because they're all treating dietary related diseases. And the public is sick and tired of being sick and tired. They're demanding that the doctors know more about nutrition. And the whole system is so creaking under pain for acute, after the cow has left the barn, procedures of bypasses and stents, that even the insurance companies are looking for ways to keep people healthier and maybe not put out so much money. So there's glimmers of hope. There's little wisps and threads of promising ideas and possibilities. But as a nation, and the COVID pandemic certainly brought out, we are, the COVID virus loves people who are obese and diabetic and hypertensive, and sure had ripe pickings when it came to the Western society's populations for that, and really smartened up a lot of folks, I hope. So we still have a lot of work to do, and Dr. Popper and I in the trenches here trying to help people both one at a time and on a larger educational level. I think are still more determined than ever. There's nothing else to do but keep educating and keep working and setting a good example and offering people hope and guidance. And so, and Steve, that's what this conference is about. So we really appreciate your invitation to address your audience.
Thank you.
Yeah,
Yeah.
I echo everything that you said. I think that definitely I would love to report that everybody's eating well and caught on and that sort of thing. I would add to it another dimension that goes to some of what we do in my office. We've always felt that if you don't improve your diet and lifestyle habits, that there's no health without doing that. I mean, you can only mitigate if you're not prepared to do that. And I've always felt that anybody, doctor or otherwise, who says diet doesn't matter, the average adult puts 1 ton of food through their body every year. So it's almost incomprehensible that you could think that that wouldn't matter one way or another, good or bad, right? But the broader issue is the healthcare system, which is incredibly broken and has gotten incredibly worse, particularly in the last year. And when I talk about the healthcare system, I talk about everything from the incessant testing for no reason at all, the overprescribing of drugs, the withholding of information about things. I mean, it has always bothered me that in order to be a mortgage broker, you have to understand it's a felony to not disclose everything to a mortgage borrower, right? If you do it enough times, you actually go to jail. And you can be a medical doctor and not tell patients that this treatment doesn't extend your life by a day, or that, and you're not required to do that. And there's no real penalty for not doing that. And so I think that we tend to sometimes, those of us on this side of the issue, beat up people a little bit for not taking better care of themselves, but they're not properly informed, And I wanted to share this with you. My mother was sick for the latter third of her life, and I could never get her to listen to me. So those of you out there who your family won't listen to you, some of us don't do any better who are in this field. But one thing that I do know, she sure did listen to doctors, and she listened to them until they killed her, really, with overtreatment and drugs. And I am almost certain, I would bet my net worth on it, that if a man or a woman in a white coat had said to my mother, Eleanor, I'm not prescribing any more drugs, you're not having any more procedures, none of this stuff is helping you, and you need to change your diet and take off that weight and the whole, I don't know what she would have done, but I do know this: she would have listened. She would have at least listened. She didn't listen to me, but she would have listened to them. And so this is still going on. My mother died in 2012. This still goes on every single day. Over testing, over medicating, too many procedures, and not enough focus on the right things. And then there really is no consequence for this behavior. And I think that's the only way this is going to change, is if we get to the place where there are consequences for not doing some of the right things. And so I think education, you mentioned education, I think that's the key. And I'm convinced that consumer education is the key. The consumers can be really powerful, and go to their doctors and tell them what the plan's going to be. And I'm seeing more of that going on. And then I have to say, this is something I want to share, because I also think it's important to focus on the bright spots too. So it used to be that when people we were working with would go back to their gastroenterologist and say, listen, I don't want to take Humira for my IBD, I'm going to do something else. The first thing they would do is call us quacks. And the second thing they would do is, it's irresponsible and you're going to die if you don't do it. And we're seeing probably 30% less of that kind of behavior now. And so I think I agree with you. I think there's some waking up going on, which is good to see. And I think part of that is learning that diet and lifestyle are important. I think part of it is the medical profession has been beat up a little bit on lack of respect for patients, right? Which we wouldn't tolerate in any other field. Like if a realtor said, buy this house or I'm not going to help you move into one, people would walk out of they'd walk down the driveway and drive off, right? So I think people are starting to find their voice. They're starting to take a little more control of their health. The message is getting through to the health professions that they have to be more respectful. And I think if we just keep going in this direction, we're going to get where we want to go. I'm 64 years old. I just want to be around long enough for it to happen, right? And I agree. Thank you, Steve, for giving all of us a way to reach people, because education to the masses is the key. And I think you have some of the broadest reach of anybody in this field.